Hello, I'm Dr. Dennis McKenna. Welcome to another edition of Inside Albany Med. And today I'm pleased to welcome Dr. Megan Keenan. We'll talk about that in a little bit. Megan is the Director of Quality Management here. Welcome.
Thank you so much. It's great to be here.
I have been looking forward to this for a while because, first of all, you're one of my favorite people here. I think you have such a tremendous story. It's one that I think is a great story to tell. And I think it would be amazing for the rest of the workforce to learn it and to hear it for themselves. So take us back to the beginning. First of all, how long have you been at Albany Med?
So I have been here in the building since 2004.
Right.
So coming up on my 20th year here.
Okay.
Took a little break while I was in nursing school,
Right.
And then came back in 2007.
Okay, so we'll get to nursing school in a minute, but let's go back.
Yeah.
What role did you start in when you first came to Albany Med?
So when I first came, I was an ASA. I supported the registered nurses for the vascular surgery department.
Okay. And what unit did you work on? Were you in the inpatient or the outpatient location?
I was here in the A building, and we supported inpatient and outpatient. Yep.
I'm sure even when you started, you probably worked with Dr. Darling at the time, Dr. Kreinberg, Dr.
Absolutely.
Roddy.
For sure.
Right? So,
Yep.
so you started as an ASA.
Yep.
Okay. And I remember when we first talked, back when I first met you, even then you knew that you had an interest in doing things in the clinical space. You were always interested in data and quality. So what was the next step you took after being an ASA?
Yep, absolutely. So I was very inspired by the nurses that I supported and decided that I was going to transition into a clinical role. At that time, I needed to continue to work full time, so I made the choice to become an LPN. Went to Samaritan Hospital School of Nursing and became an LPN, worked there clinically in their emergency department, and met back up with Dr. Roddy, who saw patients there. And I said to him, I'm ready to come back to Albany Med. I've sort of gotten what I need from my education, and I'm ready to come back. And so he said, we want you back, and then came back over and began working clinically in their outpatient area as an LPN.
Okay, so you're an ASA.
Yep.
Now you're an LPN.
Yep.
And then what's the next step in your journey?
And then decided I think I can do more. So I enrolled in Excelsior College with the support of tuition reimbursement, and went to nursing school and graduated with my RN in 2011. And at that point, transitioned over to outpatient angiography, worked in their the clinical setting in that area, and then quickly decided to continue on. I didn't want to end there, and so did a bridge program from my associate degree to my master's degree in clinical systems management, and worked in clinical research for the vascular surgeons at that same time.
I'm getting tired just hearing this. So now we're up to your master's in clinical systems management.
Yeah.
So now you're starting to get more involved in not just the clinical, but the quality side of things and how to improve care.
Absolutely.
But you weren't done.
Wasn't done then. So that at that point I transitioned to the quality management department and decided I think I've got a little bit more. I'm a lifelong learner. And so then I proceeded on to get a DNP, which is the doctorate in nursing practice. And the focus of a DNP, it's actually a clinical terminal degree in nursing, and it's connected to a PhD in the sense that where a PhD generates original research, DNPs take that research and that new evidence, and then they disseminate that into practice. And so that is, in essence, what quality improvement is: finding opportunities, finding gaps in practice, and then filling those with evidence-based strategies.
So ASA, LPN, BSN, Masters in Nursing, Doctorate in Nursing.
None of it could have been accomplished without the tuition reimbursement opportunities and the motivation from my colleagues here. Absolutely.
Well, it's very kind of you to say, and I think you're really a wonderful role model for how Albany Med offers those opportunities, and you've taken full advantage of it. And we've been obviously a beneficiary as well. Now, I know of your work in a couple areas. Let's go back. You did a lot of work when I first met you in NSQIP.
Yeah.
Tell everybody what NSQIP is and why it's important for our surgeons and our surgical quality.
Yep. So in quality in general, there are kind of pillars of quality, and one of those is clinical registries. And NSQIP is a very large clinical registry, the National Surgical Quality Improvement Program.
Right.
This is a program that has hundreds of participants, where millions of cases every year get entered into this. So what we do is, using nurses with clinical background, they take information from our scenarios and from our patients' charts, put them into this registry, and then what we get back from that is outcomes. How did we do? How did our patients do? And where do we compare as far as others? And then we drive change based on sort of what our most clear opportunities are from that registry.
And I know this, you've not only been the person who helps pull the data out, but you also work with the surgeons. I know you work very closely with Dr. Valerian and trying to improve quality outcomes. And then you've presented nationally on daises and forums and platforms with our surgeons on surgical quality improvement at Albany Med.
Absolutely. Our surgeons also use the quality data for their academic purposes, but you're right, that information is really valuable for doing things like either publishing in a peer-reviewed journal or presenting at a national conference. And we've done that many times with NSQIP data, other COVID data that we've used, and then various other registries that we partake in.
And you obviously started with surgical quality, vascular quality, but now as the Director of Quality Management, you work with everything. How many different quality improvement teams do we have here at Albany Med?
So right now we have almost 40 quality improvement teams. It really is very robust programs. These are teams that are multidisciplinary. They do not function without input from every sort of corner of the hospital. Providers, physicians, nurses, bedside nurses, others like radiology. We've got pharmacists all on these teams, and what their job is to identify in the area. It might be a departmental type of quality improvement team, or it might be a topic, and they identify areas of opportunity, and then they focus on those.
I've always been so impressed at Albany Med of the willingness of our frontline staff who want to help us get better. Whether it be a nurse working on a committee trying to reduce falls in the hospital, or maybe somebody working on reducing catheter-associated tract infections or surgical infections. We have a workforce that really is trying always to move us forward, right?
I totally agree. We get some of our best ideas from people who have experience, either from here or from elsewhere, that they bring to us. And then likewise, we take the information that we learn and that we generate with the QITs, and then we share that. One really unique thing about the QITs right now is that we're very often sharing things that we learn here with our partners and our affiliates, and we often learn from those affiliates too and bring that information here.
And how will Epic improve that when we have one singular medical record across the system? How much better will it be for us to all improve as healthcare system?
Absolutely mission critical for our department, and of course I know it is for the hospital, and for all of our system. I think one of the things that is going to be really valuable when we track outcomes, it doesn't end when the patient leaves this hospital. It sometimes starts way before they get here, and it ends long after they leave. Right now, I think I've heard that we have 11 or more different electronic, and so you can imagine how complicated that is for the nurses who are quality specialist nurses to dive in and try to find every bit of information they need. So imagine how impactful Epic is going to be to our workflow.
Longitudinal care and being able to follow the person wherever they are in our system.
Yep.
So let's shift gears a little bit. I could talk to you all day about quality, but there's just another part of your world that I'd love to talk about. So outside of work, you have, I think, some unique skills and some things that you do that we talk a lot about. You live on a farm.
Yeah.
And talk about your farm and who some of the cohabitants of your farm are.
Sure, yeah. We live on a hobby farm. My husband and I and our kids, we really enjoy nature. We have a 30-acre, just small, maybe a homestead. We have a herd of dairy goats. They're Nigerian dwarf goats, and we milk them. They're so cute. They have babies every spring, so we really love those guys. We have horses, pigs. We have a really amazing turkey.
What is the turkey's name again?
The turkey is Basil.
Basil,
Yep. And then a big flock of chickens.
And I petitioned unsuccessfully to do the filming of this at your farm just because I thought it would be fun to be out there. But I've seen some of your videos as well. You have fun with it, right? On your farm. I've seen your kids and, and they're out there. And so what's it like for them to be growing up in that environment?
It's terrific. We really just do have a fun life. We try to stay sort of really engaged with nature. And by the way, I brought you a little care package
from
the farm. I would love to share some items with you.
Okay.
Okay, so here you go. So my son is an entrepreneur. He's our chicken husbandry, and so we brought you some eggs from our chickens.
I love myself a good egg salad sandwich.
Yeah.
I'll make one later. That's wonderful.
Great.
By the way, I should say Shady Clover Farm.
That's right.
Okay, fresh eggs.
Shady Clover Farm.
Okay.
And I brought you some goat milk soap. Fantastic. Okay, we make our own soap.
Oh, I love it.
Yeah.
Shady Clover Farm, goat milk soap. Look at that. That's fantastic. Man, that's great.
Does it smell good? Right?
It does, yes. Nice? Oh,
I know.
Yes, actually quite good.
I know.
And maple syrup.
Maple syrup. Now, they say that Vermont is the best, for maple syrup, but I'm telling you, there's nothing like New York maple syrup.
Okay,
really.
Very good.
Yep.
Well, we thank the trees and the goats and
You're
the
welcome.
chickens who help provide, and I thank you.
You're welcome. And then the one last thing, when farmers are not busy in the winter, we have to keep our hands busy and stuff. So I learned how to do
oh my goodness.
Now, and I know that you love purple.
I do.
Right?
Yeah, I do.
So I tried to incorporate some purple into a nice scarf.
Oh my God. I feel like Doctor Who now, right? So this is great. This is wonderful. I didn't expect gifts.
Well,
I'm humbled by this.
I
this
wanted
is
you to come to the farm, but maybe another time when the weather's nice.
Well, I'd love to bring the kids out there. Thank you. This
You're
is very
welcome.
kind, and thank you to your children as well.
You're welcome.
So let's end it back here in the hospital.
Yeah, for sure.
What's it looking like for you in the future? What are you looking forward to this year and beyond?
So huge excitement. My department is doing a lot of work to support the Epic Go Live. Yep. We've got 7 super users from our department of 21.
Thank you.
And we're really happy about that. So that is kind of the momentum that we're aiming toward. Right. As far as other things, I did want to, I thought a lot about, kind of what to say. Right now, it's a stressful time, right? Yes. We're having some challenges. It's hard for people to, right? Change is hard. And so I just offer this, right? You don't plant a seed and pick a fruit on the same day, right? It takes time, right? You have to nurture it. Change is happening, even though we might not all see it. It might not all be obvious. But what I'm really looking forward to this year is that we're gonna get there. We're gonna get to where we want to be with this. And so I'm really inspired by the people around me who are sort of continuing to look forward and to be excited about what's to come.
Well, I couldn't say it any better. I think honestly, your professional journey here is an inspiration to me. I'm sure it will be to others as well. I think you're a tremendously valuable member of our team, as is your department.
Thank
I
you.
really thank you for taking the time to share your story with us. And I thank you and your department for all the work you do here.
Well, thank you so much.
And I'll see you out on the farm.
Okay.